Hey everybody, I just wanted to take a few minutes to talk a little bit about insurance. I had a few nasty comments about me on the internet a few weeks ago, and it kind of hurt because someone called me a scam because I don't take insurance. And so, if anyone knows me, I don't take insurance inside my physical therapy practice. And there's a lot of reasons for that. And I wanted to take a few minutes to discuss the state of insurance and what it kind of looks like so people maybe understand a little bit more about my rationale behind that and why it's actually better for you. And so, the first and foremost, nobody really understands the healthcare costs associated with their care. If you go to the doctor and you say, "Hey, how much does a visit cost?" They don't know. If you go to the hospital and you ask how much the MRI is, they don't know, and it always depends. And the reason why it depends is because they have different contracts with different insurance companies. And so one insurance company will only pay $500, the other insurance company will only pay $1,000, and whatever it is the numbers are, I don't know. But the point is they each have their own contract. And so, and that contract is usually based on leverage. If an insurance company has a lot of leverage with the medical provider, then the costs are quite low. And then the other way around, maybe you're the only game in town and the insurance company kind of has to have somebody in network in that area. The leverage kind of goes towards the medical system there. Well, private practice physical therapy clinics actually have a very low amount of leverage, and the contracts are very small compared to maybe what's normal. And you'll find that true in healthcare practices that are more independent. But with any either small business or independent service providers, whether it's healthcare or even just contractors or mechanics, usually the smaller the company, the more personalized care you're going to get, the more involved the CEO or the owner is. You're going to get a lot more effort to make you happy, as opposed to if you're just a massive group. Bigger groups aren't going to really work too hard because they have the volume involved in that, and they've got their systems in place, and the owner is far removed from any either patient care or services that are provided. One other thing that you need to consider, at least nowadays, is kind of where we are in terms of our healthcare insurance programs and plans. Most are high deductibles. Most insurance or co-insurance numbers are really high, and then the co-pays are also pretty high. We're seeing deductibles of $5,000, $10,000 pretty regularly at this point. Most people have been forced into these kinds of plans with the elevating costs associated with their medical insurance plans. With co-insurance, that is the price you pay, a percentage of a cost. So we're usually seeing 20 to 50% co-insurances, and that's usually after the deductible's met. And then you see these higher co-pays as well. If you do have a co-pay as opposed to a co-insurance, you're probably better off. And you're usually talking between $25 and $75. Specialists like a neurologist or a pediatrician, a physical therapist, tend to have the higher co-pays as opposed to just a regular physician, like a primary care physician, probably has a lower copay. And PTs, you can see copays of anywhere from $50 to $75 a visit, period. And it's really hard because medical providers raise their costs to reflect this. So what they'll do is they'll raise their costs maybe to 150% of what insurance companies will reimburse, and it's usually that best reimbursement. So a good example of what could happen with people's insurance is they have this high deductible, let's say it's $10,000, and before the insurance even kicks in, you have a co-insurance of maybe 20%, but that's only after deductible is met. So really, you're responsible for $10,000 of your medical care directly off the bat. And so now the question is, well, what do I do in terms of getting medical care? And most people just don't know what they're going to get. Nobody knows really what they want. If you go to, let's say, a physical therapy clinic that is designed to take insurance, what they'll do is they'll charge you $250 to $450 per session. And that price, they can't change the price necessarily because of you not having it, because you're not going to meet your deductible. They have to keep prices consistent throughout. And so what they can do is, they can give you a discount, but really, if they're billing your insurance, they can't give you massive discounts. And the reason why is by law, they need to keep things level. So, for example, if you go in and you have no deductible, they'll charge $450 for the visit, and they'll only get reimbursed maybe $100. And there's reasons for that, and I'm not going to get into today. And let's say you go in with your deductible of $10,000, they still have to charge the insurance company $450. The insurance company comes back and says, deductible's not met. Here's your bill for $450. And I've heard this story over and over and over again, and people just don't realize this. Now, not all insurance plans start reimbursing until the deductible's met. Sometimes there's a copay before the deductible's met. Maybe that's 20%, or let's say 25%. Well, if you're getting charged $450, or let's just say $400 to make it easy, and your co-insurance is 25%, that's $100 a visit you're still responsible for. And so that's a big number that people don't realize, that they're like, yes, I want to use my insurance. Well, this all boils down to cost effectiveness and what you're getting for what you're really paying. People don't really understand the real cost of their health care. Let's give you the best case scenario. People go into their physical therapy clinic. They charge $400 per session. They do have a 25% co-insurance before the deductible's met. So that's really good. So you're actually paying $100 a visit. What are you getting for that visit? Well, most people don't realize physical therapy practices every year wait and see in January to hear what kind of cuts they're getting in terms of reimbursement. 1 year over year, what they'll find is they're really getting reimbursement cuts, especially from Medicare. That's the most profound one. It's every year, it's about 3%. This past year in 2020, and the change was going to take effect 2021, the proposed cuts that were passed was 9%. Put yourself in my shoes for a moment and think about a job that you have right now, and every year you learned that you get a pay cut and not a pay raise every single year. It's astonishing that we actually live in a world where this happens. Cost of living goes up. Everyone gets raises next to you and beside you, your friends. Everyone's getting raises most of the time. Whereas in physical therapy, we're actually getting reductions of our pay. And that's a problem, especially when you need to run a business, especially when our reimbursement rates are lower as it is. So for example, that $100 co-insurance that we're just talking about earlier, that's kind of maybe all we would get. Now you think, oh, $100 for a session, that sounds really great. Yeah, until you consider the fact that, all your costs associated with running a healthcare business. Most physical therapy practices have a profit margin probably around 4 to 6%, maybe 10% if you're really, really good and you really keep your overhead low. If anyone's out there, a business person, would realize that that's a really low profit margin. And then people are hearing that every year we get cuts. And so a lot of physical therapy practices have converted into what I would consider a PT mill. A PT mill is a practice in which they mostly emphasize exercise and not manual therapy. They don't just have one-on-one care. It's usually 2 or 3 patients per therapist. And usually that therapist is a physical therapy assistant with only 2 years of education behind them. Now, some physical therapy assistants are excellent. I'm not trying to rag on them, but I'm also not going to make, I'm not going to be too shy about saying there's a difference between a doctor of physical therapy who has 7 years of schooling and really intense education behind biomechanics and physics and anatomy versus someone who went through a 2-year program, even out of school. Some are excellent, but there is a qualitative difference, and I'd be remiss not to at least emphasize that. Another thing that these PT mills do is they, when they double things up, they're not allowing their physical therapists to really treat their full potential. So what ends up happening is the outcomes go down. And then the outcomes come down because the quality is not there. Not any one physical therapist or physical therapy assistant's fault. Okay, it's more of a system problem than it is a therapist fault. And then what happens is the insurance company goes, why would we want to pay you more because your outcomes are not all that great? I'm not paying all this money so that someone can still have all this pain. I still have all these costs associated with it. And that makes a lot of sense, actually. And so, people don't get better as much as possible, and people think, oh, okay, I guess 80% is okay. No, it's not. I'm a Christian. I really believe that God gave us bodies that heal themselves, and my job as a physical therapist is to help facilitate that healing process. And yes, full healing can happen all the time. And even if the pain's been there for 20 years, even if the pain's been there for, it's really intense, the high levels of pain, it's actually something that we can fix. And I want to encourage you all, just because you think you're getting benefit from your insurance company, you may not be. I highly recommend looking at your plan and seeing what your plan says before you go out and looking for care. A lot of clinics will help you understand that. If you were to tell them, hey, here's my insurance card, they'll tell you what your costs are going to be and whether or not your co-insurance kicks in before or after you hit your deductible, and what your deductible is and everything. Many people will go get their therapy in an insurance-based clinic, and what they'll find is that their bills are several $100s, especially because, like I said earlier, all the lower quality care that you're going to get with PTAs doing most of the treatment and multiple patients and mostly exercise. You're kind of going in a circle with a bunch of other people. You're sitting there on the table waiting for your next instruction. I know you all have been there. What ends up happening is your visit number goes up. So instead of needing only 6 visits, maybe you have 12. And if you have 12 visits, that's $1,200. Where in my practice, you might spend $700 out of pocket, but you only needed 6 visits, and you actually saved yourself a ton of time. The value's there, but people just don't recognize that. And I want to do a quick follow-up and do some math in a following video, maybe next week. And I want to discuss specifically what the numbers could look like in my practice versus another practice. So if you have any questions, just give me a call at my office, and I'd be happy to discuss a little bit further what your insurance is actually paying and what you're actually having to pay for your care.